Yes, now we'll discuss about the femoral nerve. Here is anterior superior iliac spine. Here is pubic tubercle. This is pubic bone. Here is inguinal ligament. This is inguinal ligament. This is front of thigh. Here is sartorius muscle. This is femoral triangle. Here in this diagram, this is inguinal ligament. This is medial border of sartorius, and this is medial border of adductor longus. This is femoral triangle. Here a sheath is present, which is formed by fascia iliaca and fascia transversalis. This sheath is known as femoral sheath. This is femoral sheath. It is divided into three compartments. A lateral compartment, one here is femoral artery. This is femoral artery. Femoral artery gives three superficial branches and three deep branches, and one of its deep branches, profunda femoris. This is profunda femoris artery. This profunda femoris again gives medial circumflex femoral and lateral circumflex femoral. This is lateral circumflex femoral artery. This artery is a lateral circumflex femoral artery. Lateral circumflex femoral artery, which is a branch of profunda femoris artery. Here is from here to here, deep to this, there is pectineus. This part is iliacus, and here is tendon of psoas major. So this is psoas major, this is iliacus, here is pectineus, this is adductor longus. These structures form the floor of the femoral triangle. Now we will start discussion about the femoral nerve. Here is ventral ramus of L2, L3, L4. This is ventral ramus of L2, L3, L4. This ventral rami divides into ventral division and dorsal division, or anterior division, posterior division. So this is anterior division or ventral division, which forms the obturator nerve. This is obturator nerve, which gives supply to the medial compartment of thigh. And this is the dorsal division of ventral ramus of L2, L3, L4 joined to form femoral nerve. So this is femoral nerve. Here it passes between iliacus and tendon of psoas. Between iliacus and tendon of psoas. Here. Before passing below the inguinal ligament and between these two structures, it gives supply to two muscles. One muscle is Here it gives supply to iliacus. This branch, nerve to iliacus, rises above the inguinal ligament. And another branch is nerve to pectineus. It also rises above the inguinal ligament. It passes deep to this sheath and gives supply to the pectineus. So nerve to iliacus and nerve to pectineus, these two nerves rise above the level of inguinal ligament. Below the inguinal ligament, it passes between the iliacus and tendon of psoas. And here you can see this is profunda femoris artery, and this is lateral circumflex femoral artery. This is a branch of this, and this artery divides the femoral nerve into two divisions, anterior division and posterior division. This femoral nerve is divided into two divisions anteriorly. This is anterior division, and one another which passes behind this. This is posterior division. So two division, anterior division and posterior division. About 4 centimeter. This division is about 4 centimeter below the inguinal ligament. This length is 4 centimeter, and it is divided by lateral circumflex femoral artery. And divisions are anterior division and posterior division. Now branches. Branches of anterior division. First of all, we will discuss about the muscular branches. This anterior division gives a branch to this muscle. This muscle is sartorius. It gives branch to sartorius. So it gives one muscular branch. Anterior division gives one muscular branch to this muscle. This is sartorius, and it gives intermediate cutaneous nerve of thigh. It gives medial cutaneous nerve of thigh. So it gives two cutaneous nerve, medial cutaneous nerve of thigh and intermediate cutaneous nerve of thigh. So anterior division gives muscular branch, that is nerve to sartorius. Posterior division gives muscular branch, nerve to, here is nerve to rectus femoris. This is nerve to rectus femoris, nerve to vastus lateralis, nerve to vastus intermedialis, nerve to vastus medialis. So it gives 3 branches here and 1 branch here. Nerve to rectus femoris, nerve to vastus lateralis, nerve to vastus intermedialis, nerve to vastus medialis. And it also gives a branch to articular genu. Articular genu. So this posterior division gives all these muscular branches. Anterior division gives only one muscular branch. Posterior division gives muscular branch. These are muscular branches. Nerve to rectus femoris, nerve to vastus lateralis, nerve to vastus intermedialis, nerve to vastus medialis, and articular genu. So these are muscular branches. Now cutaneous branches. Anterior division gives 2 cutaneous branches. Medial cutaneous nerve of thigh and intermediate cutaneous nerve of thigh. And posterior division, this posterior division gives only 1 cutaneous nerve, that is saphenous nerve. This is saphenous nerve which passes towards the medial side, and it passes on medial side of the leg, and it goes up to ball of big toe. This is longest cutaneous nerve in the body. So these are cutaneous branches. So you have seen muscular branches and cutaneous branches. Now articular branches. This nerve to rectus femoris gives supply to hip joint. Nerve to vastus lateralis, vastus medialis and vastus intermedialis gives supply to knee joint. Nerve to vastus medialis has fibers of proprioceptive in nature. So it has proprioceptive fibers. It also gives supply to the vessels, vascular branches, vessels which passing to this region. These are the branches of femoral artery. It gives vascular branches. So this is all about the femoral branch.